Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders past, present, and emerging. Hey everyone, and welcome to Raising Parents, the Parenting Science Insights podcast, produced by Ella Massell, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I'm your host, Dina Sargeant. Let's get started. Hey guys, and welcome back to another episode. Now, have you heard of baby blues or postpartum? Now, we've spoken about that briefly in the show previously in previous episodes, but today we'll be looking a little bit deeper into it. Our guest today is a psychologist and an author whose clinical specialty is going through depression. Her book audiences range from adults and children. Please welcome Dr. Deborah Serani. Thank you so much for joining me, Deborah.
Thank you so much for inviting me, Dina. I can't wait to talk about this very important subject.
No, I can't wait to discuss this as well because, like I said, we've spoken about this a little bit in previous episodes, but never to the detail that we're about to go through today. Especially, like, you hear a lot about baby blues. You hear a lot about, the postpartum anxiety that sort of takes place. But you never really understand, especially from my point of view, I've never really understood the depth that the feeling, the emotion is sort of tied together to, especially the inability to leave their child the minute that they have the baby, the constant focus on them. So I'm really interested to sort of know a little bit more about that emotional attachment and how that can be such a process to sort of relieve the anxiety a little bit more.
Well, I'm happy to detail and go into all of these things so it doesn't become such a confused or mysterious experience. It's a lot more common than most people realize.
Okay, well, I'm so excited to talk about it. But before we do, now, as a psychologist, what exactly is your role in sort of helping a lot of families through going through that process of during the postpartum?
Well, as a mental health specialist, the mental health emotional well-being of a new mother who's struggling would be my specialty call. But also a physical physician, doctor, nurse would also be part of this team approach because postpartum issues really carry with them enormous physical and emotional pieces. So my goal is to help the new mom identify what's going on, help the partner and family members to support what's going on, and to create a healthy bond between infant and parent, and then reduce symptoms so this doesn't become a concern as both continue on their journey.
Mm-hmm. And what have you heard to be the most common frustration that either parents or individuals who go through that have sort of expressed to you?
Well, when it comes to baby blues, I think some people tend to minimize that experience, which we'll talk about in a little bit. And when it comes to the severe postpartum, or what's better called perinatal, meaning before pregnancy, during pregnancy, and after pregnancy, that there's a lot of shame moms feel. It's supposed to be a bundle of joy. And for 20% of mothers, it is not that at all. So there's a lot of shame and guilt about when you feel I can't be connected to my baby, or I don't understand why I am so sad, or why I'm so restless. So confusion about baby blues, confusion about postpartum, and a lot of shame. Those are the main issues.
Well, I can't wait to talk about it at all, especially going further. And thank you so much for that introduction. Before we do get deeper into it, I'd love to get to know some of your interests and maybe some recommendations for us today by playing a little icebreaker to hopefully get us warmed up in order to answer bigger questions later on.
Sounds good.
To start off with, what is a favorite book that you have?
Well, when I think about this, I think about a book that I would want to read over and over and over again. And for some reason, I love the book A Prayer for Owen Meany by John Irving. And it's a story about these two little boys and the little town they grow up in, their exploits and loss and death and adoption and girls and love. And it just is this microcosm of just life and some of the miraculous things that occur throughout this book. It makes me cry. It makes me laugh. And it's a book I'll come back to time and again. So A Prayer for Owen Meany by John Irving is just about my favorite book.
I feel like a book that makes you cry, laugh, and makes you feel emotional is the criteria for a great book.
Yeah, and I just love these little characters and their innocence and the little things and mischief they get into. And it's just a really wonderful world that Irving built in this story. So yeah, when I get asked that question, I go, what is my go-to book? Oh yeah, it's A Prayer for Owen Meany.
Your book sounds a lot more happier than my go-to book. So I deeply like my go-to book is probably Normal People by Sally Rooney.
Yes, very good. That's a good book. That's a good read.
Yeah, it's a really good one. It's the book that I'm convincing all my friends to read, but that book sounds a lot more lighter and a lot more of
than Normal People, for sure. Yes, for sure. Normal People is a meaningful read.
Yes, it is. Probably a bit too meaningful. Probably holds a lot more sentiment than I care to admit and a lot more relatability to it as well. But no, the book, I've heard of Irving before as in different writing different books, but I haven't heard of that one. So I'm maybe going to look that up a little bit later after the show and have a look.
To me, that's a gem. And there's another nonfiction. I always think of fiction and nonfiction. A nonfiction book, a true story, and it's called Chosen by a Horse. And I'm blanking on the author's name. And she was rescuing horses, and this was a horse that she didn't want to rescue and did, and how it changed her life. And oh my God, beautiful, moving, crying. So I guess I like emotional reads.
I'm totally with you there. I completely understand that. I feel like my go-to are the ones that make me cry far too much or make me frustrated far too much.
But then there's always The Very Hungry Caterpillar, which is a children's book, which is just fun and silly and light. So that's another book I love.
Yes, well, I still have that book from when I was a little kid in my bookcase because I can never find myself getting rid of it or wanting to get rid of it at all.
It's so pretty, right? It's such a pretty book.
It's such a one that reminds you, oh, life is so simple sometimes.
It can be, yes.
Yeah. Now, do you have a movie that you've enjoyed recently that you could share with us?
I just saw The Holdovers. That's up for an Oscar this year in the States. And it was a very lighthearted slice of 1970s. And I really enjoyed it because I found it again. Oh my gosh. Funny. I cried. It was meaningful. It was but light. It was light. So I really enjoyed watching that. So that's my most recent film. I saw it over the weekend.
Oh wow, that sounds a great one. I think the movie that I recently started watching, I don't remember. I watch TV shows more than I watch movies, I think, mainly because I can stop a TV show at any point and catch up. With a movie, you finish it, you forget almost instantly until you have to restart, go back probably 30 minutes to go back to remember what's happening. But yeah, no, I want to see The Holdovers. I think it's out. Is it out in cinemas? It's just come out, did it?
I saw it on streaming. I don't know what it's like for you guys down under,
Okay.
but yeah, I enjoyed it. It was just I didn't expect to like it, and I did very much.
Okay, perfect.
I did very much, and keep an eye on Paul Giamatti's eye. That's all I'll say.
Okay, now you make me really want to see it. So I have to go and keep an eye on that now. So when it comes to podcasts, are you listening to any podcasts at the moment?
I'm a psychology nerd. I'm doing this almost 40 years. So in the States here, we have a podcast that the American Psychological Association has. So I'm endlessly listening to it because it's talking about new research or case studies. So I'm a bit of a nerd when it comes to that. And occasionally I'll listen to some true crime or I'll listen to some entertainment stuff. But yeah, I'm basically plugging in to podcasts to like learn. I really love podcasts for that.
Mm-hmm. No, I agree with you there. I am a huge, not only psychology, but also when it comes to true crime areas. So going into the mindset of a serial killer. And there's one podcast, I forgot the name of it, but I love listening to it because it comes out with daily episodes on like a crime that happened that certain day. And it goes back about 40, 50, sometimes 60 years going back in, and talks about how they were evaluated and things like that. So that's where my brain always goes to when I think about podcasts, and that's the pretty much my go-to one. So when it comes to psychology, I love different kinds of psychology episodes. That would have been one field that I would have studied if media didn't grab my attention, but psychology is such a great thing to do research on.
It's like, well, to me, I fell into it because it explained life, and I needed a lot of help with understanding life when I was younger. So, but media, I can understand what draws you to media because that's a very exciting field as well.
Yes,
Many
I'm glad I get
different
to do
layers.
both. Yeah, no, I'm
Yes,
definitely glad that I get
particularly
to do
with this.
both.
Yeah, this is a perfect marriage of that. That's right.
Exactly. Now, when it comes to role models, either in your professional or even personal life, do you have someone or maybe a group of people that you find yourself looking up to?
Um, I have a lot of mentors along the way that have been great resources of encouragement and teaching and a soft landing to kind of just figure out what it is and who I want to be. I never really had a role model, like one person who I said, gee, I want to be just like him or her. But I will say it definitely took a village to kind of get me to where I am. And I'm very grateful for the acquaintances, the friends, even the strangers along the way, but mentors who really took the time to, their time to kind of encourage me and help me. And it's nice that I can reciprocate that now at my old age, that I can do that with younger people. And it's a wonderful legacy. So, yeah, there are some really wonderful people that I hold dear in my heart that have really been just great champions to help me find my way.
No, that's amazing. Going from a mentee to a mentor, I think, is such a great way to sort of pass on knowledge, because like you can learn so much from a textbook, you can learn so much from research articles online, but learning from someone else, I think, is a whole lot more important, and finding like the little cutways here and there that other people have discovered along the way is such a great thing. So going from being someone who's learned from other people to sort of teaching other people has really definitely shown the full circle that really goes around.
Yeah, I think of it as like a relay race when you grab the baton, somebody hands you the baton, now it's your time, and you're running that lap, and now you're going to pass it on to the next person. You know, for me, or at least my experience, I really didn't have a lot of people in my life. So to find other people who were interested in uniquely understanding me and helping me, it was like, oh, I have to pass this on. How can you not?
No, exactly. No, I completely agree. Now, when it comes to I hope you're all warmed up for all our questions
I am.
today, and I
I'm
hope
ready. I'm
we're going to go
ready.
deep dive into it now.
Mm.
Um, So I know that everyone has a very different definition as to what parenting is or what the role of being a parent would be. Either from what you've learned professionally or personally, what do you think your definition of parenting is?
That is it. It's such a great question because it can't be answered in one sentence. But the way that I view parenting personally is like my job to help my little one grow and learn and evolve to the best of his or her ability. And my responsibility is to kind of help him or her get used to the world and understand who they are. It's such a multifaceted experience. Professionally, I love the field called conscious parenting.
Mm-hmm.
It's a very mindful parenting where we're not looking to help our children grow and learn with manipulation or punitive experiences or certain types of stressors. We're really taking each child and uniquely helping to see what he or she needs. And as a parent, that's what you bring to each child. Because if you have different children, you know that parenting is going to be different for each and every one of them. But parenting is, to me, the most important job, and one that nobody will be perfect in. But if you can learn to make sure that what you're teaching and doing is for the best interest of your child, that's where the mindfulness comes in into conscious parenting. So, we become aware that it's not our agenda that we want the child to succeed. We want the child to succeed because he or she has this talent or he or she can learn and grow from this. So parenting it's such a great question, and I could probably talk a whole hour on parenting. But to me, it's the goal of empowering each child uniquely in their own way so they can find their way in the world.
Mm-hmm. No, I think that's such a great answer. And when I hear the different answers that I get throughout the show, because I ask that every single time we start the show, and the different ways that people almost say the same thing, almost say, allow a child to sort of have the space and the comfort to be who they really are, or have that ability to choose a path that they see fit and try to encourage the best out of them. And I feel like that's the greatest answer for parenting as well. Just having that idea of that you're not sort of putting pressure on a child to be exactly who you want them to be or have that expectation. Because I know that from my experience seeing that from my friends, there's a huge drawback in sort of seeing, okay, it's so easy to be like, this is how I want you to be. This is how I want you to mold. This is how you have to fit into that mold. And the minute that they don't, there's that frustration at the fact that they aren't who they are supposed to be, but you're forgetting that they're being who you want them to be.
Right, right. And guilt and disappointment. I'm disappointing my parents if I don't do this. Or, if the authenticity is such an important piece to our lives that each person should live their life the way that best suits them. And sometimes we as parents get lost in that, okay, we brought this child in through, biology or adoption, but they are their own person too and deserve to find the world in a pace that serves them.
Exactly. So if you were to sort of give advice to someone going through that transition of being a parent, what kind of advice would you give them sort of in that preparation?
Another great question. I know that we all have pre-wiring and instinctual behaviors when it comes to being a parent. But what I would say to people is it's okay to not know what you're doing. I would say that that's the most common thing that occurs in my office is that there's a sense of permission that I give to say, nobody does this job well. Nobody out of the gate knows what to do. But if you're always trying to be your best. And you make a mistake, because I make mistakes. I make so many parenting mistakes. The thing that really is, to me, the most important thing parents need to know is that repair in the parenting bond is where you need to place your effort. Because it doesn't matter, oh, I said the wrong thing. Oh, I lost my temper. Oh, I can't believe I said that. Oh, I can't believe I did that. You go back to the child and you say, mommy shouldn't have yelled at you, or I'm so sorry that mommy didn't pick you up on time. It's not so much the ruptures or the difficulties or the problems that come, because we expect that. What many people don't do is that repair. And that's the parent-child bond. The child will forgive and learn. But if the repair isn't there, it creates guilt in the parent and maybe resentment in the child. So what I would tell new parents, if you can trust your instincts, but also not be afraid to visit and kind of say, I made a mistake, or I didn't know, or I'm sorry, I'll try better. That's not the parenting I grew up with. I had very authoritative parents. But research tells us that that's the key to helping children, that kind of parenting style.
Okay, so when it comes to the whole idea of postpartum, because I know that's exactly where we're going into throughout the show today, and this ties in really well with that. Can you provide a quick little overview of what postpartum well-being really encompasses and why it's really crucial to focus on that when it comes to mental health, especially?
Well, babies that are born to new mothers, even mothers who have had babies before, 20% of mothers will fall into what's called a relapse of a previous mental health illness. So postpartum is not a singularly occurring thing that happens after the birth of the baby. Research believes that it's heightened at the beginning of pregnancy. So most women who struggle with a postpartum or peripartum issue have had either a previous mental health illness or what's considered a subclinical. Maybe they didn't know they had depression or bipolar disorder. And so the reason why it becomes so vital for us as a world to kind of identify this and help new mothers and fathers is because infant death mortality is highest 15 days after the birth of a baby. The death of new mothers, maternal mortality rates are enormously high the first month after a baby is born. So we're not just talking about health for the sake of being sick or ill. We're talking about life-threatening issues that can put a baby at risk and a mother at risk. So we in the States here consider this an epidemic, a national emergency. We have one of the highest mortality rates for new mothers here in the United States. And I know the World Health Organization has also made a campaign effort to help educate individuals as well as professionals, because even medical and mental health professionals don't really understand the clock that ticks when a baby's born, because time greatly affects diagnosis. So everybody gets baby blues the first 2 weeks. But after 2 weeks, if you're still struggling, it's not baby blues anymore. It's a serious mental illness.
Okay. And you're talking a little bit about infant death mortality. Can you define what that is for us, especially for me, who I've never heard of that before?
Well, when we think about a mother and a baby, as a species, we require immediate 24-hour care. Little horses are born and they're galloping, 2 minutes later. So if we have a depressed mom, and again, this is not about blame, this is not about shame or judgment, but if we have a very depressed mother, depressed father because the mother's depressed, or a highly anxious mother, suddenly the care of the baby is a concern. Babies need round-the-clock comfort, holding, feeding, changing. And if a mother is really struggling, it can greatly affect the health of the baby. So we know that poor care results in devastating results for some babies. And not that every person who struggles with a postpartum mental health illness is at risk for hurting themselves or others, but it does elevate the risk. So infant mortality, meaning the death of a baby, can occur because certain things are not being tended to. Baby might not be fed, maybe baby is too cold or left in the heat too much. And it's, again, not to blame the mother. The mother, with these mental health issues, we'd be worried singularly about the mother, but because there's now a duality or even twins or triplets, we now, it exponentially heightens the risk for illness and death. So that's why it's so vital. Infection, surgical things. Sometimes a mother may not be really aware of her body because she's preoccupied with really significant illness in the psychiatric piece. So mothers can die from hemorrhage, sepsis, things like that, only because they're not in a well enough state to say, oh, I don't feel good.
It must be, it's also the difficulty for asking for help as well. Like when you sort of see in films as well, films are a great portrayal of sort of the differences between reality and what the media sort of portrays. Because when you see in films, they go home from the hospital, then they're taking care of the baby, then they're going back to normal, they're going back to work within like 2 weeks of the baby.
Right.
When you see in reality and you hear about even just the overview of what you're saying, it changes the reality so much in my head from what I understood, post-child, post-pregnancy, and sort of dealing with that, because the whole reality of it is that there's so much that you have to look into, so much more than, oh, I can just go back to work straight after, or I can just, even C-sections, you plan a C-section, you have the child, and then you dive back into work straight away. It doesn't really work like that.
That's right. Yeah. That's right. There's like a heightened, surreal piece because of technology and Instagram and TikTok and celebrities having babies and going back to work and their tummies tucked and, they look glamorous. Or, like you said, there's a great movie, Tully. It was with Charlize Theron. I thought it was beautifully done. I think it was written by Diablo Cody. And it was about a mother having a baby and what happens during that. I won't say too much in case anybody watches it, but it was a really great, realistic slice of life of what reality is in the present day. Most people, most families, both parents are working, and life is very fast. And the water cooler of social media, wait, you're back to work? Wait, your baby's sleeping through the night? Creates this competitiveness. It was much better when we didn't know what our neighbors were doing. Mm-hmm. So, it's 1 out of 5. That's 20%. 1 out of 5 mothers will have a postpartum perinatal mental health issue. That's high.
Yeah, no, that is a lot higher than you sort of think about as well. In reality, when you think about that situation happening, the statistics really change a lot of the views that you have on, okay, this is a very common issue. It's a very common situation. It's something that a lot of people are experiencing. Some don't even know that they're experiencing it, especially when it comes to, like you were saying earlier, about the prior depression that they may not have realized that they had prior, or they had it in them, and then they experience that for the first time. Not only do they experience post-baby blues for the first time, sometimes they really experience depression for the first time as well. And even acknowledging the fact that it exists in them must be such a huge realization for them as a person.
I as a clinician, struggled with depression very early in my life. And that's kind of been my focus in my career, to kind of debunk and demystify what depression is. So I knew before I was going to have a baby that I got to really keep an eye on things. And I had a very good pregnancy, but I fell into it was immediate. As soon as the baby was born, I really felt quite unusual. And I said to my husband, I don't feel good. This doesn't feel right. I'm not bonding with the baby. It's okay. It's baby blues. You'll be fine. Talked to my medical doctor. Well, give it some time. And I said, I'm not giving it any more time. I'm in trouble. And it was even hard for me to convince my team of professionals that I need something. I need help. And there's also a cultural piece to this, where we know that people of color, people of lower SES, struggle so much more with postpartum and getting access to care. So that raises the risk for maternal death as well as infant mortality. So, there's a lot to learn here about what baby blues are, when to be worried that it's something more, and how to really help families take this seriously, because by the time it's really serious, it can be really bad.
No, that's really true. Thank you so much for sharing your experience through that as well, and your personal experience through that. It's very interesting to sort of go in depth into it and hear it from a perspective that only a few people can actually say. And so I really greatly appreciate you sharing that with me as well.
Well, I think it's an important thing, especially if you're someone who's writing about a subject, or, you're an expert about a subject. I became an expert in it because I went through it and said, come on, not talking about this. We got to talk about this. So let me write about it. And it is helpful for others, whether it's their first time being a parent, or even professionals that I talk to and say, if you don't know what it is, it doesn't matter. Just know what the symptoms are and help your patient. You don't have to know something to treat it. But there is so much about the baby bundle of joy, and this is, a happy time, and how's the baby? People lean in, they say, how's the baby? And you're like, I wish I didn't have this baby. I'm so overwhelmed. You're not supposed to say that. What's wrong with you? There's something wrong with you if you say that. No, there's an illness. There's a real illness interrupting this bond between parent and child.
So what do you think are the most common misconceptions about postpartum, and also the postpartum well-being that sort of takes place as well, especially from your perspective? And how do you think that we can work through to sort of debunk some of those myths that you're listing?
Well, one of the things that we need to first start with is that being a new mother or father, 10% of fathers get postpartum also, as do adopted parents. You don't have to have a biological child. If you're a surrogate giving birth, you're giving the baby away, you can find that you have a postpartum even though the child is not with you. The demystification here is to understand that pregnancy and delivery are enormous stressors, triggers. And if you're somebody who struggles at all emotionally, that's most people of the world. I don't know many people who, skate through life, emotionally unscathed. But it's an enormous stressor, and we need to be more welcoming and more contact, more networking, much more acceptance of mothers and families struggling at this time. Like you said, some people go back to work after 2 weeks. France has got it down. The country of France, you're home for a year. And the research tells us that physically and emotionally, psychiatrically speaking, it takes about 9 to 12 months for some women to really come back to who they were. So the myth of this is a happy time, we need to kind of throw that away. If you're lucky and you have an easy baby and you have a resiliency, that's wonderful. The next myth we need to take away is that there's some kind of shame attached to this, that you're defective or you're not a good parent. I actually tell some of the moms and families who come in here that because you're so upset and you're here means you're a wonderful parent. You are saying, I need help. And that's not something to feel shame or stigma about. We need to have greater care. There's not a lot of care and screenings and testing that can help pinpoint what's going on before a baby's even delivered. Here in where I am in New York, they do screenings every 3 months, a pregnancy, 3 months, 6 months, 9 months. And, so they're tracking individuals and families early on and measuring the statistics of their feelings and things like that. So those were like the major demystifying things that, we need to really understand that it's like a car wreck. It's like a freeway, accident, a volcano exploding. It's a seismic event for some families to have a baby. And we need to stop the mom shaming or the family shaming. Oh, really? The competitive piece to having what a baby's like. That's why I tell parents, okay, deactivate all your social media. I don't want to see anything shiny in your hands. No electronics, nothing. And just bond with your baby and heal.
That's such great advice, I think, especially sort of dealing with it. And I know one friend, especially, she took down all her social media. She put all her social media on private. She didn't post anything, didn't take photos of her baby for, I think, 2 months. It was the longest, and she didn't let anyone see the baby. So she didn't let the family see the baby for about a month as well. And they weren't allowed to take photos because she's a very anxious person. So going through that, she was like, okay, I really just need the time. And she is well educated on like baby blues and postpartum because she also went through depression beforehand. So she sort of knew what to expect from her doctors as well. And she was very aware of, okay, situations like this may happen. She's always prepared. So I was not surprised when she knew everything. And it was such a great thing to sort of watch her make a list. Okay, this is the things that she sort of expects. Her birth plan not just included the fact that, okay, the normal things that it would list, but also included who was allowed to see them, who was allowed to be around them, what things can come in, because she also knew that she waited until the baby got vaccinated and all that. So she was very well prepared months before. And it was amazing to sort of see the amount of detail that went into that, because it's a scary concept to think how much you have to be aware of beforehand and how much information isn't just out there until you ask for it, which is very strange to me. Because like you expect, okay, you're carrying a baby, you go to a doctor, you should expect them to tell you a list of things that you need to be aware of. But when she went to the doctor, all they said was, okay, the baby looks fine, you seem healthy.
That's right.
Off you go.
See you in 3 months.
Exactly. And she was just like, she was annoyed, and because she goes private health as well. So you'd expect them to be a lot more thorough, but they were exactly the same as like a normal doctor going in to see a doctor and check if everything's okay. And that's a scary thought to see in Australia, of places that we have like Medicare, we have all these healthcare things that allow us to be looked after really well. And it's scary to think the fact that they're not having those ideas like, okay, this is what to look out for. It was such a strange concept for me to not know. And then you see other countries like France, Sweden, Amsterdam, and when it comes to their birth plans, when it comes to their both mother and father gets to stay home from work
Right,
for
that's right.
6
Their
months.
infant mortality rates are so low.
Exactly. And it's such a scary thing that we as a world, that we say we're so ahead of the game, we aren't in this area.
It's a funny thing because, gynecologists, obstetricians, doctors, they kind of like, I've taken care of you and the baby, you're good. I got, 100 other people I got to see. I feel like educational systems, there should be parenting courses, there should be child development courses in public and, like early grades before university. So we get exposure and we learn very young the important things of how to self-care and what to look for in our own physical and emotional well-being. But your friend did a great job because she consciously, mindfully created a plan to keep her and her baby and her family safe and healthy. That's so wonderful.
Mm-hmm. No, I was really glad that she was able to set those boundaries. Not all the family members liked it. A lot of families felt that it was disrespectful for not to let the elderly, like the grandparents, see the baby for the first time. But she set clear boundaries. She knew that she was going to do that. She's a very headstrong person, so I'm not surprised that she didn't do it. But it was amazing to sort of see how much you have to be prepared and how much you have to be prepared on your own, and tell a doctor who has studied all this what they want to expect.
Right. So that's a big burden to carry on your shoulders if you don't know what to look for.
Mm-hmm.
And if you have, here in the States, the average appointment is 4 minutes with the doctor, 4 minutes. So that's not a lot of time to talk about concerns.
No.
And I guess this is true for a lot of things in the world nowadays. But the more we talk about, the more there's podcasts like this, shows, books, magazines, TV shows, things that talk about maternal care, maternal health care. Extra healthy bonding creates more well-being in babies, higher academics, successful employment for a child later in life. So, this 0 to 3 years old is such a crucial time. And if a mother is really struggling to kind of hold it together, it really has big effects not only on her, but on their child as well.
Mm-hmm. No, I completely agree. And I know that we've spoken about baby blues a little bit earlier in the show and throughout the show as well. But what are the key differences between how sort of baby blues goes, like you said, over the first 2 weeks, that postpartum, post-pregnancy, and something more serious like postpartum mood disorder? And how do you sort of differentiate which one is taking place?
So, when a woman is pregnant, there's so much physiological changes, neurochemistry changes. The minute the baby is born, some women go through a significant hormonal drop, and this drop causes baby blues. So 80% of women who give birth will have baby blues. So this is categorized as irritability, tearfulness, sleeplessness, restlessness, kind of feeling uncertain about what to do as a parent, maybe feeling a little scared of the baby, eating too little, eating too much, behavioral changes that clearly anybody would say, wow, you're really having a hard time kind of going through this. So that's 80% of women. What happens after 4, 5, 6 days, the body starts to rebound from that hormonal drop. The body starts to heal. For some pregnancies and deliveries, it can be an enormous taxing experience physically for a mother. So the body slowly starts to heal. And by the second week, those who have baby blues, they resolve. The mother is sleeping, eating better, feeling better. There's bonding going on. The feeding is going okay, whether it's bottle or breast. And so that goes and continues in a positive way. But for some, it worsens. So 2 weeks is a measure. In the field of psychiatry and psychology, time helps diagnosis. So if you're sad every few days and then you feel better for the rest of the month, chances are it's not depression. If you have a panic attack or you're anxious and then 3 months later you're fine, chances are it's not a panic disorder. So the criteria, meaning the diagnostic way we look at things, is that if a mother has had some baby blues and they're in their 3rd week or their 4th week and they're still struggling, chances are it's going to be the onset of a postpartum, peripartum mental health disorder. So the interesting thing is that most people think postpartum is depression, but there are 7 different kinds of peripartum mental health disorders. You can have postpartum OCD, you can have postpartum bipolar disorder, postpartum generalized anxiety disorder, postpartum depression, postpartum psychosis. So based upon what the individual is experiencing, chances are the mother, the father, family support, or maybe even the obstetrician will say, something's a little bit more serious is going on here. How about we go to a mental health professional and do a workup? Let's see what's going on. And let's get you evaluated to determine if you need assistance. And what a screening will do is it will lead to someone like me, and then I'll be able to help determine what type of peripartum is going on and what treatments can best help.
Mhm.
So 2 weeks is like the measure. So, if somebody's struggling, that first month, it's no longer baby blues. It's something more.
Okay. There's honestly so many different, like you said, there's 7 different types of postpartum perimortem disorder. And there's so much that you sort of have to encompass. Like, not only everyone, when you say that you've had a baby, focuses so much on the baby. They focus so much on, oh, you've had a baby. How's the baby going? What's the baby doing? They're making sure the baby is fed, looking after. But you barely look at a mother and be like, so how are you going? So what is going on? Like, even in movies or even in other friendships that I have of people who have kids, they're so excited to see the baby. So excited. Oh, I can't wait to see the baby. I can't wait to hang out with the baby and be around them. But you barely really focus on the mother and really look into see how she is or see the different ways that you can help her. And that's the thing that really scares me, is the fact that if you don't have that kind of support
That's right.
on the mother, is just as scary as not having support for a baby. So
And, I'm sorry, Dina.
no,
Go
that's
ahead.
fine. No, that's fine.
Go ahead.
I was going to ask, when it comes to partners and the other kinds of support that come in, because like you said, partners also suffer from postpartum as well. They sort of go through their sort of experience baby blues as well. How can they sort of best be a support to the partner who's going through it, or at least sort of have the tools to recognize that this is something even more, if the mother hasn't really recognized the fact that there is something going on?
Again, education is so helpful. Just about everybody who's going to have a baby will do some type of birthing class, right? Lamaze, Le Boyer. I'm trying to think of some of the other ones that are out there. And this would be an ideal time to bring into the curriculum the notion about making sure you check in on each other, heightening the effects of postpartum on the mother and the father, creating a way, a dialogue to, extended family. How did we check in? I remember when I was struggling, my in-laws were very unsupportive in the beginning, and my husband was kind of stuck in the middle. And I had said to him, I'm sorry your parents don't see this as serious. I'm telling you it's serious. And he was a good enough listener that he was able to kind of push those who didn't see or a concern about what was going on to the side to say, all right, my partner is telling me she needs assistance. I have to do what I have to do. I don't care what the chorus is singing to me on the sidelines. But it does become hard. And we really do need to educate all kinds of communities about, the effect of new babies in their community, because it affects us all. It really does. So what partners can do is to just try and keep a dialogue going. Behavioral change is a great tip. Something's different if your partner's different, if they're weepy or they're crying. Because having a baby is a life-changing experience. So can losing a job. So can a car accident. These are called triggers. And when there's a breakup, a divorce, or somebody passes and dies, we give a little bit more wiggle room to say, oh, you're sad, oh, you're depressed. But there's something about the baby that makes us think, well, it should be happy. And it isn't. It's really a very tough time for a small, vulnerable margin of individuals.
So that's the thing that really scares me, is the fact that people don't talk about it, or they don't see it as a serious thing, or because it's not commonly spoken about. It's not something that we normalize talking about. Because I can only imagine if one of my friends were to say that they're going their experience, that I have had a friend who has experienced it. She always used to say, oh yeah, I'm fine. That's her first answer, because she just knew that she had to be about the baby. She had to focus about the baby. She was never really focused on herself, and no one really knew what was going on with her because she didn't know what was going on with her. And she jumped into being mom mode rather than healing from being a person. So she became a mom quicker than she sort of recovered to being her normal self. And luckily she had her partner with her, but there was so much that she had to really open up about, so much that she didn't even realize that she was actually feeling. And that's why this subject is such a big thing for me, because it was a huge time that no one knew what was going on with her. No one knew that there was something deeper than what was happening. And no one knew what to do about it as well, because especially like you're saying a little bit earlier, culturally, it's not something that you talk about. Everything's swept under the rug. Everything is, oh yeah, I'm fine. I'm okay. I'm so excited to be a mom, so excited to do all this stuff. But there's so many more things that you have to really think about when going through that. And there's so much more that people are not really willing to open up about, that they experienced the same thing, or that they have experience in it, or they have dealt with that before, because no one wants to talk about it.
Right. And, sometimes the media, this is, my sharing of I love media, but sometimes media does look for the sensational. And when we read about a postpartum mother in the news, it's generally a very terrible story. But that's 1%. That 1% of postpartum psychosis makes other mothers or other families afraid to say, I'm having trouble. But because you have a peripartum or a postpartum experience, it doesn't mean that a thought you have or an urge you have or a sadness you have is going to lead to a terrible thing. And that's what prevents people from coming forward. And many, many doctors, the research shows, at least here in the States, that patients, 25% of patients, that's a quarter of the patients that come in after they give birth, are afraid to tell their doctor they're struggling. We got to change that. You're afraid to tell the doctor. I'm afraid they might take the baby. They might think I'm a terrible parent. These are real fears. But the statistics show us that it's so rare that something terrible happens from a mother to a child in that direct way. But that's the sensational piece of postpartum psychosis, which is very, very rare.
See, that's the scary thing. Not opening up to a doctor, I feel like that's such a big aspect. Not opening up to someone who is there to help you or who is there to be that support, who has knowledge on that. I think that's such a worrying topic and such a worrying idea, that the fact that they're not really wanting to discuss it in fear of something happening or something, the baby being taken away or being seen unfit. And so it diminishes that honesty.
Oh, yeah. It definitely affects the patient-doctor bond. Mm-hmm. I was talking to a big group practice here in the States. And one of the things that I said to them is, you have to stop enforcing breastfeeding. Yes, it's the best. It is. But a mother struggling with postpartum probably can't do the breastfeeding. And if we're looking at a healthy return of, well-being, the husband has to do the bottle, breast pump, have the bottle fed, and if some parents can't even do that, they have to go through formula to just, for the mother to heal. We have to be okay with that, So at least my perspective is, you can definitely have skin on skin bonding and bottle feed a baby. Come on, we could do it. Especially if there's a real serious vulnerability and fragility in a mother who the latching doesn't happen or the milk doesn't come in because the mother's stressed. We got to stop saying, got to breastfeed the baby. So that's that's one of my big things. Like I'll talk to parents and say, how's feeding going? It's awful. Okay. So can you pump? Yes. Okay. Can your husband do some feedings? Great. Put it in the bottle and let's go. You can't you got no milk. Don't worry about it. Let's just go to formula. And the doctor's like, what are you doing? Like, trying to save some lives here. Is breastfeeding really big in Australia? It's huge here. It's almost militant here.
Yeah, I think it's the first thing that they prefer to push first. And then what I heard from friends, at least, that's the first thing that they try to do in order to allow that bonding in the hospital. Right. But at the same time, you don't hear about formula. There's like a whole idea that you don't really hear about formula until after they've done that. And I've had a couple of friends who have said that they didn't realize that formula was an option because it's not something that is normalized. It's not something that is really understood as being an option for early on in the infancy. So it is a scary idea of like what people are telling you and what's societal norms and what's actually okay.
I mean, if we didn't have formula, that's a different story. If this was, 300 years ago, that's a different story. But I've worked with some mothers who, there's a ruminating kind of anxiety that some mothers have postpartum, where they are worrying about everything in such like a spin cycle on a washing machine. It just doesn't stop. And, they can't really soothe themselves or the baby. I'm like, okay, so your husband or your partner can feed the baby. Let's get some formula then.
Mm-hmm. No, that's very true.
It's about being reasonable in the face of illness. I mean, if somebody was in a car accident, would we expect her to breastfeed? Similar.
Exactly. So this ties in really well with the last section of our show, which is the open mic. Now, this gives you a time to talk about and promote anything that you would wish to promote, or maybe talk about some things that we didn't get to talk about throughout the show. In the last minute or so, I'd love to give you the floor and have that space and share what's on your mind for today.
Well, I just would like to say to anybody who's listening that there's no shame in experiencing a mental illness. It's a way for our bodies to just kind of let us know what the best way it is that we need to take care of ourselves. Some people have physical issues, some people have emotional issues. And if you're struggling and you have a baby, no matter where you are, talk to someone you really trust and care about. And if you can't find the help yourself, ask them to get the help that you need. And that's like my whole life's work is that there's no shame in living with mental illness. It's a very common experience that we have to normalize. And when it comes to me, if anybody wants to see any of my books or read any of the work that I've done, they can just visit me at my website, which is drdeborahserani.com.
Perfect. Thank you so much, Deborah, for sharing a lot of these insights and a lot of your own personal experiences as well. And if anyone who's watched the show before definitely knows that I love to promote mental health and promote it as much as I can. So I deeply appreciate the huge shout out to promote mental health as alongside me and alongside the show. So thank you so much for that. And I'll definitely have a link down below to your website if anyone is wanting to learn a little bit more or maybe find the books and find the different resources. So your books are both to be related to adults and also children as alongside that as well.
Right, on different mental health issues.
Perfect. Well, thank you so much for that. And thank you so much, Deborah, for joining me on the show. It was amazing having you on.
Thank you. I'm so happy. Thank you for inviting me. It was lovely to meet you.
It was lovely to meet you as well. And if you guys enjoy the show, I hope you guys did, and I hope you guys learned as much as I did when it comes to baby blues and postpartum, and really understanding how you can sort of go there and be a support to someone who is going through that and maybe have some insights that you didn't already. Thank you guys so much for listening, and I'll see you guys in the next episode. You've been listening to Raising Parents, the Parenting Science Insights podcast, produced by the Parenting Science Labs, a division of LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcasts, Google Podcasts, Spotify, and other podcasting apps available on your devices. If you enjoyed this episode, please consider rating our show, sharing it, and subscribing to our channel, as it helps other people find it so that we can grow and bring you more quality resources. More of our work can be found on our website at pa.lmsl.net, where you can join our movement. I'm Dina Sargeant. Thanks for tuning in.